I'd like everyone in the room to stand up. Okay, now sit back down. About 1/4 of you will have put more weight through one leg than the other during that transition. Do you think you were one of them? Do you think you or someone watching you could tell that you were? That's just one of the indicators that you're one of the 33% of the people in this room living with the specific health condition that I'm going to talk about today. Later in life, 87% of you will have your quality of life substantially reduced by this same condition. And by the time you're just 50 years old, 10% of you will have had major traumatic surgery to try to alleviate its effects. It's called a musculoskeletal condition. That's any issue of the bones or muscles that affects the way that you move. Now, despite all that, there's no service you can go to quantify your risk of developing a musculoskeletal condition. No service to lower that risk. Physiotherapists and orthopedic surgeons are amazing professionals, but we don't give them the tools to help you until you're basically falling apart. Surgeons get x-rays, doctors get blood tests, but in 2019, physiotherapists still get nothing to enable preventative care. They mostly rely on their sight while watching you move. At Vitrue Health, we've developed a computer vision-based system that can accurately and quantitatively measure patient motor function. With our technology, you go to see your physiotherapist the way you would today. The device sits in the background and uses biomechanics algorithms to detect the most minute of changes in your performance of standard physiotherapy tests. Crucially, it avoids interrupting the patient-clinician interaction using scene interpretation algorithms. The device understands what test is being run without having to be told. Now, by providing this data to both you and your clinician, we can empower them to intervene earlier and prevent oncoming issues from becoming debilitating. This technology improves patient satisfaction, it improves patient throughput, and it introduces new preventative care revenue streams for healthcare providers. This year in the UK, in the private health sector alone, patients will have their motor function assessed by sight 3.5 million times. Bring Europe and the US into that, and it's about 153 million manual assessments, and that's an untapped market. We charge per assessment like an API call model, making a £3 billion opportunity for us at Vitrue. And that is before we expand into wellness settings like sports clubs, gyms, care homes, and insurance. And even that is still just the beginning. Assessments like blood tests have moved from confirming a diagnosis to detecting issues early and preventing them before symptoms even emerge. And the data set that we're collecting at Vitrue will provide the foundation for that same shift in the entire musculoskeletal health system. We came to Techstars 90 days ago, and we had the core science in a demonstrator prototype. I'm delighted to report that in those 90 days, we've launched in 2 of London's top physiotherapy clinics, Oxford Circus Physio and PhysioEd Medical. We're working with Mr. Simon Ball, who's one of the world's leading knee surgeons. We're trialling with a Premier League football club. And perhaps most excitingly for us, we've signed up Bluecrest, who's one of the UK's leading private and corporate health screening providers, and who assess 80,000 patients every year. So for me, I personally have been working on this problem for over 10 years now. I started with a PhD, and I found that from that setting, I could solve the problem academically. But as my younger self is showing here, not particularly practically for existing assessment pathways. I went to work for the world's #1 motion capture company, designing cameras to track human movement. And again, in that setting, I found I could make more and more accurate cameras, but not usable in real-world healthcare. Finally, I met my co-founder, Alex, who's an expert in biomechanics and the smartest engineer I've ever worked with. We decided to put together a team and solve the problem ourselves. As a team, we've developed world-class musculoskeletal services. We've designed bridges, blood diagnostic devices, MRI scanners, video game engines. This team really is the perfect set of people to solve this problem. We're going to be testing everybody's balance in the demo area after this. Come find out where you stand. Thank you.